We're with Jonathan today.
What's up, guys?
You haven't seen him in a while, and we're bringing him back because he's not feeling good today. You got a cough, allergies. He's been
sinus
coughing a bunch.
infection.
Yeah, not good stuff going on. So we're gonna give him a little bit of a supportive work. His mid back is really locked up. He said he's been coughing all night, and then he said I've got a lot of pressure in my sinuses. So I'm just gonna show you an easy sinus release, doing some soft tissue work on that area, and then we'll adjust him accordingly based off of that. So when you cough a lot, or when there's a lot of tension from coughing, obviously that motion will cause stress in the joints. But we got to learn about some cool. From a somato, the body, to the viscera being the organs, a somato-visceral connections between the nerves. So there's something called, I believe, J receptors, and there's some arguments that say that when you adjust a joint, especially around the thoracic spine, you reflexively will have an impulse or change the reception of that J receptor. So there's a feedback mechanism. Some people say that it helps with clearing up some of the phlegm in a lung, right? So you'll see people get percussion, that's straight force to the spine, as well as the adjustments to help bring up some of that phlegm. He doesn't have phlegm, but it can help with some of that congestion and tension in the chest. So I don't necessarily say, hey, come on in, everybody's got a cold, and adjust them, but when people do, I tend to focus on the mid-back and thoracic spine. Interlace your fingers on top of your head for me. Good, elbows come together, roll forward, good. Take a breath in. Easy exhale, trust me here. Good, elbows open up a little bit more. Relax your shoulders, breathe in again for me. And really let go here. Relax your chest, good. Take that breath in, keep your fingers in locked. Good, try not to fight me so much through that chest here. Good, looser here. Good, ooh, baby, good stuff.
Nice.
All right, come follow me. On your stomach, okay?
Yes, sir.
You're coming in. I'm not gonna shut you out, Liam. Sorry. Go ahead. You're good. There you go. Sebastian?
Yes, sir.
You can hang with us, man. You're picking up some of the stuff that I'm saying. Sebastian and Jonathan are heading out to chiropractic school.
107 days.
107 days. So a little percussion here, okay? So 107 days, and we're going over anatomy, we're going over soft tissue work, and we've gotten away from it a little bit recently, but we're going to do a little bit of a program getting them ready for some of their science courses. So really anatomy is a big one that once you kind of see it once, it can help you when they go through the program and go through in chiropractic school. They'll go through an entire cadaver. They'll study every muscle in the body, then they'll go through the organs, they'll go through the viscera, they'll go through brain, neuro, anatomy, and dissect all those things from a human body. People donate their bodies for science for those reasons. A lot of medical schools and chiropractic schools. It's really cool because we learned a ton from that, and that visual aid is something you will never forget. Relax your shoulders here for me, Jonathan. Take a breath in. Easy exhale. Really a lot of pressure on this adjustment from my hands. There it is. Good. Little extension restriction here. TL junction. Breathe in for me. Exhale, let it go. Good. Good. There you go, bud. So some people come in with phlegm and we do that percussion. Patients with cystic fibrosis that have that done, they get up a lot of that phlegm because they're not able to clear up the phlegm because of that muscle atrophy. But yeah, I tell people when we do that, hey, you're gonna have to haul a couple loogies up in the parking lot most likely. So here, on your back for me, Jonathan. This is a nice way to feel that tension. Come all the way on your back. Good. Sebastian, would you grab that CBD oil, Craig? Thank you. Jonathan, Jonathan's rotation is really good, but he's has a little restriction in extension here. So I usually do a lateral break adjustment at C0, C1, or or distraction. So distraction here for Jonathan. Good. So a little sinus work now, okay? Two areas that we do a little sinus pressure release on. Maxillary and frontal sinuses, right? So coming into the frontal sinuses, really good firm pressure across the forehead. And he's really not feeling that great. He's definitely gonna need some rest tonight. He's got worse as the day went on. He really suffers from pretty bad allergies. And so he'll feel a lot of pressure over this spot right here. You can feel that tension build up underneath underneath my thumb, and if you have the right angle on the right area, just holding that pressure for a few seconds and gliding along the course of the sinuses really can provide a lot of relief to that area, to the patient. There's certain things I remember as a kid getting done when it comes to soft tissue work or adjustments. Without a doubt, I totally remember my dad doing this to me. Kind of hard to forget that. Having someone shake your face. Someone to shake your face now, Jonathan.
Oh yeah.
It's face shaking time. There we go. And you can kind of start to hear that that mucus start to move a little bit. It was kind of like a brick, and now we're getting a little bit of motion in that track. Good. Good blood flow to the area. Movement is key for those in any kind of sinus problem, any kind of allergy problem. The mobility of the fluids is the primary focus of any of the treatments that are out there, right? That's the precursor for that problem, is a blocking up or a reduction in a different 2 layers of mucus within the membrane. So I think it's the first layer basically is there's an overproduction of that fluid, and you can't, the cilia or the cells that push that fluid across kind of basically lose their function, and you get this buildup of either your own flora or a bacteria, or usually a virus, or in this case just irritation to the mucosa. So movement is what we're going for in a lot of our treatments, and especially in this one too. Sometimes we can go in and use what's called an activator. It's a really light tool in terms of adjusting. It creates an impulse underneath the head here, and it's really focused, and you can control the amount of force. So there's a lot of different types of instrument adjusting tools out there. This is a simple one, and we use it from time to time, not too often, but in certain cases. So for like a jaw, I might use it. For a kiddo, I might use it because it's really gentle and focused. If they're having some irritation to the joint, or for sinuses, I might use it. So relax. Good. A little tender on that one?
Yep.
Alright, buddy.
Thank you.
Sure. Alright, we're all a big family here, so we take care of each other. Alright, Liam, nice job today, man. You're crushing it. Day 2. Pro, look at you. Steady hand.
Thank you.
The CEO. El Presidente. Thanks for watching, everybody. If you got any questions about the work that I just did with Jonathan, Jonathan, how are you feeling, man?
Really good, like instant cleared. like just airway now. I can breathe better.
Good.
Like you can definitely feel that what he was talking about, that prick feeling in my nose, just loosened up with that fluid moving around. But it's pretty intense.
It is a little intense, but I really do like that in terms of like the effect right away. You're congested, you can't breathe. I do that treatment, it's like, whoa, like I can actually get air rushing through my nostrils now.
Seriously.
It's pretty immediate. And then keeping that up is the goal with that treatment, right? Go home, do saline solution, eat foods that aren't going to make you feel congested, and that could be dairy for some people or whatever you have like an immune response to, and then making sure that you're staying hydrated. So those type of things, those good old things. Yeah, man.
Understood.
Get some sleep, brother. Get out of here. Thanks for watching, everybody.